Yes, the analgesics, as we have taken some concepts about analgesics in the management of rheumatoid arthritis, and as I told you, uh, that this is one of the group that you need to prescribe quite frequently in your clinics for your patients. Not only that, if you look at this picture, you will find different types of pains different types of pains where the patients or people suffer from. And this is one of the chief complaints that people or patients are presented in the emergency room or Fatawari. If you go to the hospital, second commonest chief complaint that is pain. First one is fever, high grade fever. Second one is pain. And there are different types of pains you can see, and one of them that is the tooth pain. So toothache or tooth pain is also quite common, and the patients that you will receive in your clinics downstairs as well as later on in your life, many of them, they will be presented with the complaint of pain. Another very important pain that you will find in your patients, that the patients will be referred to you by ENT or ear, nose, throat consultants or neurologists. That will be headache, but that headache sometimes is referred pain. The pain is because of the problem in the teeth, and it can go up to the ear as well as to the brain. Another important pain that you will see in your common life, that is the migraine or migraine, the pain of the head. Yeah, initially it is like that, but later on it can cause the pain in the whole head. This pain, mostly in females, migraine is primarily females related associated pain, because it is related with their reproductive life. Whenever there is fluctuation in the female sex hormones, estrogen and progesterone, so they suffer from migraine or migraine. Second important reason for migraine, because sometimes males also suffer from migraine, that is genetic. It goes in families. So if someone in your family has the history of migraine, so the children most likely suffer from migraine also. Okay. The medications that we use to control these pains, they are called analgesics. As I told you in the beginning, it is a combination of two words, AN means absence, and algesia means pain. Because these medications reduce pain, so we say they are the analgesics. Now these analgesics, we classify them into two groups. One are called opioids, and the other one are called non-opioids. The opioids, as the name indicates, that they are derived from the plant source opium, afune. I hope you know afune. Opium, you know?
Yes.
What is afune in, I think the same Arabic word, maybe afune, opium. So this group is very old. It is as old as the human being itself. From very long time, uh, the opioids have been used, like morphine, pentazocine, uh, codeine even available here in Saudi Arabia, dextromethorphan, then pentazocine, all of them, even heroin, if you remember I told you somewhere, heroin is also basically very strong analgesic. But the problem that we face with opioids, that unfortunately all the opioids derivative, they cause addiction. They cause addiction. There is no question that they are the best option to control pain, even in dental practice. Sometimes you will find patients, they are not responding to any analgesic except opioid analgesic. But the problem that we face with this group, that is that they cause addiction. So for this reason, we reserve it for only severe or intense pains that don't respond to other analgesics. And secondly, they are not available in Saudi Arabia or pharmacies. They are only available in the hospitals, so that you should keep in mind. The second group, non-opioids. In non-opioids, again, we have two groups. One is called non-anti-inflammatory, and the other one is called anti-inflammatory or anti-inflammatory. As you discussed quite in detail with Dr. Ali about inflammation, one of the cardinal signs of the inflammation is pain. But many times pain comes without inflammation also. Like in infection, there is no inflammation. Sometimes in fractures, there is no inflammation. Similarly, in toothache, there might be no inflammation. In headache, there might be no inflammation. So if the source of the pain is non-inflammatory, the source of pain is non-inflammatory, so then the best option is paracetamol. The best option is paracetamol. Apparently, Panadol or Solpadeine or these drugs seem to be nothing because we use it in our common practice. But in fact, if they are given in appropriate dose, like if the patient is 80 kg, so he needs maybe 3 or 4 tablets together, so it is very effective. But if we give paracetamol underdose, not appropriate dose, then yes, they are not very effective. One thing. Second, inshallah, you will find that sometimes paracetamol is combined with other NSAIDs or non-inflammatory, non-steroidal anti-inflammatory drugs. Combination therapy of paracetamol with other is also available. Okay, the next group, that is anti-inflammatory. Again, we have two subgroups in anti-inflammatory. One is steroidal and the other one is non-steroidal. As we discussed last week, that in fact the steroidal anti-inflammatory, they are the best and potent anti-inflammatory. No one can beat in reducing inflammation the steroidal anti-inflammatory. But the problem again with steroidal anti-inflammatory, as we discussed last time, prednisolone, methylprednisolone, triamcinolone, and they are many. And inshallah you will use in your clinics, especially those who will be in oral medicine. Almost all the problems in oral medicines, they use steroidal anti-inflammatory drugs. But the problem with these steroidal anti-inflammatory drugs, no doubt they are best option to reduce inflammation or to suppress inflammation, but unfortunately we cannot use them for longer duration. Sometimes you will find, like I told you, just 2 weeks ago we had a female patient downstairs and she was using prednisolone for the last 2 years. Why? Because she was suffering from rheumatoid arthritis. Sometimes you will see in chronic COPD patients or in asthma patients, the patient will be using for quite longer duration. But ideally, like in dental practice or in other practices, the maximum duration for the steroidal anti-inflammatory drug is 3 weeks, 21 days. That's it. If we cross 21 days, then the patient is in danger zone. You know danger zone. Why a patient is in the danger zone? Because you suppress the natural cortisol that the body is secreting. And when you suppress that, what will happen? As we discussed last time, this side effects, Cushing-like syndrome or Cushing-like symptoms, hyperglycemia, and osteoporosis. Only 3 weeks after that, the patient is in danger zone. And even we discussed in osteoporosis, one of the type of osteoporosis is called steroid-induced osteoporosis. The drug itself causes osteoporosis. A young man, and he will be suffering from osteoporosis. You will be thinking Dr. Zakir told us that, and Dr. Ali discussed that osteoporosis is old age disease in males. But you see the patient is young, maybe 30 years of age. But when you go into details of the medical history, you will find that he is using the steroids maybe for asthma or COPD or some other respiratory problem, and he may suffer from osteoporosis. Similarly, the same with hyperglycemia. It can cause diabetes mellitus. Inshallah, we will discuss in our last module. There is one type of diabetes mellitus that is called steroid-induced diabetes mellitus. Steroid-induced diabetes mellitus. So, although no doubt they are very effective in suppressing inflammation, but unfortunately there are side effects. Clear? Okay, so what is left with us? That is non-steroidal anti-inflammatory drugs. As we discussed last time, aspirin, ibuprofen, indomethacin, naproxen, and the list goes on. There are so many. Again, in non-steroidal, as we will see, we classify them into 2 groups. One are those that act on both COX-1 as well as COX-2. COX-1 means cyclooxygenase 1 enzyme, and COX-2 means cyclooxygenase 2 enzyme. Both enzymes are required in the synthesis of the what? Both enzymes, COX-1 and COX-2. Where do we need them? COX-1 and COX-2, cyclooxygenase, even last week we discussed, they are required in the synthesis of EGs, or prostaglandins. And we have 2 types of prostaglandins. Good prostaglandins and bad prostaglandins. Who are good prostaglandins? Those that we need for our body for different functions, like the prostaglandins improve the blood circulation to the kidneys, blood flow to the kidneys. They protect the GI mucosa, so that are called good prostaglandins. But there are prostaglandins that can damage the GI mucosa. There are prostaglandins that are secreted in the uterus. So uterus is in males or in females? Animal. Females. So if the uterus is pregnant, and the prostaglandins are secreted more, what will happen? There will be expulsion of the baby. What we say, termination of the delivery. It can cause abortion. So although prostaglandins are good, but sometimes in some body organs they can damage. Why? Because these are the prostaglandins which are present in the inflammatory cells of the body, which are induced in response to inflammation in the body. So we have two types of enzymes, COX-1 or cyclooxygenase, that converts arachidonic acid into prostaglandin, which are useful. COX-2 converts arachidonic acid into prostaglandin, that are present in the inflammatory cells. Okay? Now, the drugs that we will use, unfortunately, most of them, they block both COX-1 and COX-2. And for this reason, they are called non-selective. No doubt, they are very effective. Most of the pains, as we will see in the next slide, the types of pains, whether it is mild to moderate pain, whether it is intense pain, whether it is severe pain, mostly these pains, they respond to these non-steroidal anti-inflammatory drugs, which are non-selective in nature. And you will prescribe in your clinics mostly non-selective, non-steroidal anti-inflammatory drugs. Okay? What could be the problems? We will look into that. So, we have, I don't know whether you discussed it in physiology somewhere, pain and transmission of pain. First thing, that there are two types of pain. One are called nociceptive pains, where the stimulus is there, and other one are called neuropathic, where the reason for the pain may be from nerve endings or from the neurons. In dentistry, that are mostly in medical practice, in emergency rooms, we have two types of pains. One is called acute, and the other one is called chronic. So if the pain is acute, what it will be sudden in onset. And this is the pain that is reported to the emergency. It could be intense, it could be mild to moderate, it could be severe. So there are different types of pains. And the WHO says on average, every day throughout the world, 30 million patients take NSAIDs. Every day, 30 million. I think more than Saudi population. What is your population?
It's around
like this?
30,
yeah.
31.
So throughout the world, daily consumption of the non-steroidal anti-inflammatory drugs is 30 million daily. So that is such a big number. That means that the pain is quite common problem. Okay? Now, usually subsides once treated. Acute pains mostly when they are, whether it is, whatever is the origin, maybe headache, maybe biliary, maybe hepatic, maybe intestinal, maybe any reason, maybe toothache. But in case of toothache, sometimes there is infection, as I hope you started already dental subjects. You will see many times the reason for the toothache is infection. So yes, these non-steroidal anti-inflammatory drugs, they will help to reduce the pain. But unless you don't treat the pathology, or the microbiology, the causative reason, the pain will not go. So that is important. More important in our clinics, that is the chronic pain. Why chronic pain? Persistent or recurring. Sometimes you will see patients in your clinic, they will be telling you, doctor, I have pain continuously, although it is mild pain, I can tolerate the pain, but the pain is continuous. Sometimes the patient will tell you, I have recurrent pain. Pain disappears for some time, maybe 1 week, 2 weeks, and then comes again. That is called recurrent pain. And that recurrent pain may be mild or moderate, sometimes even severe. So if it is severe or intense, even the patient may be presented to the ED or emergency department. And this is the pain that is often difficult to treat, even in dentistry. Even in dentistry. I was telling a story. Here I have one Indian dental consultant. He was working in Abir in Azizia. I think it is finished. They have changed it to Saudi Al-Ahli. He was working there. He told me that once a Saudi doctor came to my clinic and he was having problem in the tooth. And he visited many dental consultants for this problem, maybe 5, 6 other dental consultants. But the pain was not going. And as you know that there are first molar, second molar, third molar, because you are discussing. No, yeah. So the pain was, he was referring to second molar in the lower left side, that the pain is in this. And to the extent that RCT was done, root canal. Okay, not only this, because they think sometimes referred pain, upper molar RCT was also done, but the pain was still there. So sometimes this is experience, what happens in clinics. Then he asked, although he did previously also panoramic x-rays, you will inshallah discuss in radiology types of x-rays, and you might have done panoramic x-rays, the whole day. So he asked for panoramic x-rays. The x-ray was done, and the reason for the pain was the right side. The caries were on the right side, but the pain was on the left side because it was referred pain, but no one thought that it could be on the right side. Everyone ignored the right side, and that was chronic pain. He was treating it for the last 2 years, going from one doctor to another doctor, and lastly he got the reason. So sometimes when you don't find the reason, the patient will continue to suffer from the pain. Okay, what is pain? How chemically, like you like too much biochemistry, so we bring biochemistry. Again, biochemistry questions were difficult. I don't know, you did well, but the females were complaining that the biochemistry questions were difficult. Difficult?
Yes.
Oh, but Dr. Fathy said that this is the easiest question that I put in my life. Anyway, tissue injury causes the release of this every time happens in biochemistry. Okay, so what could be the chemical or biochemical reasons? One, the reason that there might be infection, might be fracture, whatever. But what the body release that we feel pain. So there are different types of the neurotransmitters or chemicals that the body produce in response to tissue injury. It could be bradykinin, it could be histamine, it could be potassium, it could be prostaglandins, and it could be serotonin. And I think you discussed, or not yet, serotonin. Serotonin is a neurotransmitter that plays very important role in our mood. 5-hydroxytryptamine. Sometimes we feel very happy, sometimes we feel very sad. So as you know, dopamine, as all of us are now addicted to these social media, one of the reasons body produces more dopamine. At the other end, most of the serotonin that is produced in the GI, but some of the serotonin that is in the brain. So depression and these problems come. And serotonin plays very important role in pain sensation. This is one thing. Second one, because if you see, I highlighted this. These substances stimulate nerve endings, start the pain process. What I told, that the reason what could be, maybe injury, maybe fracture, maybe infection, but when the nerve endings, they are stimulated, they start to throw these chemicals or these neurotransmitters. And then they send message to the brain that there is problem or there is crisis. Two are important, one in your practical life and one that we discuss in our discussion. First one, prostaglandins. As we discussed quite in detail, that there are two types of prostaglandins. Good prostaglandins, which are related with COX-1, and bad prostaglandins, which are related with COX-2. That, and most of the drugs that we use in our clinics, they target the prostaglandins, COX-1 and COX-2. But at the same time, inshallah, you will see in your clinics many times your doctor or your prof from 4th year onward, they will prescribe these non-steroidal anti-inflammatory drugs as well as the drugs that will act on the serotonin. That will act on the serotonin. And because serotonin is also one of the important factor or neurotransmitter in the pain sensation. Okay? Many times you will find that your doctor, your prof is prescribing non-steroidal anti-inflammatory drug together with what we say SSRI, SNRIs, or tricyclic antidepressant, the drugs that inhibit the serotonin. Why? Because serotonin plays important role in pain sensation. So that is second one. First one, in general practice, the best option that are the non-steroidal anti-inflammatory drugs, prostaglandin inhibitors. Non-steroidal anti-inflammatory drugs, whether they are selective or non-selective, but non-selective, they are more effective. Non-selective, they are more effective as analgesics. But sometimes if the patient says that my pain does not respond to NSAIDs, that you may find that the doctor will also prescribe some serotonin inhibitors. Okay? Because he might think that the doctor may think that the reason could be, apart from prostaglandins, also serotonin. The last one, that is bradykinin, and then inshallah, then we will resume after Eid. Bradykinin. Bradykinin is very important. The pain that is due to bradykinin is intense pain. The patient cannot even sleep because of this pain. And one of the very good example of this pain that we have, that is akra. It is scorpion. Google it, you know. Mostly it is in hilly areas or mountainous area like Hada, Taif, in houses. Even here on the campus, the houses, they have this problem. Sometimes they have. But hope you are never bitten by. Huh? No? Or you are bitten?
No, I didn't.
Okay. Sometimes even in camps, when you go outside, what do you say, khaymat? Yeah, so even sometimes in deserts, so they, and when this bites you, the nerve endings, what it releases, that is the bradykinin. Because the poison that when it is bitten, it gives bradykinin. And bradykinin pain is unbearable. First 24 hours, you cannot imagine. So severe pain. And most of the analgesics, they don't work. Most of the analgesics don't work. And as inshallah we will discuss next week, we sometimes use local anesthetics. The pain is so severe that we give at the site of the bite local anesthetic to reduce pain. So, prostaglandin is the primary target, sometimes serotonin, and if it is, for example, from some insect bite like scorpion, then even we use the drugs that can take care of the bradykinin. We stop here. Thank you for all these 3 weeks during Ramadan. I know it is very difficult. Leader tried and negotiated to cancel this week, but the head of department was very angry when I asked that, please, the students say why they are doing like this. So then I didn't respond to you. But thank you, all of you came. You sit for exam. I know exam maybe not very good because the doctors are not happy. But inshallah, we will try to help you during this exam, and also inshallah we have exams in coming weeks. Enjoy your 3 weeks vacation, enjoy your Eid inshallah, and then see you after Eid. And what about you? After Eid? Tomorrow? Tomorrow, okay. Okay, inshallah, tomorrow. Okay.
Is here?
Anywhere, because you are the yeah, free, yeah. So, or if you can come before 12, no problem. What time is good for? 10, 11? I think no one